So let me ask you, Jonathan, which features have the largest impact on long-term outcome in patients?
Well, while many of us are impressed when we see individuals with fluoride-positive symptoms, in the long run, though, it's negative symptoms and cognitive deficits which are the biggest predictor of functional outcomes. Unfortunately, it's still hard for many clinicians to get neurocognitive batteries on their patients, and as we will discuss extensively, we often overlook negative symptoms for a couple of reasons. Often these are less florid and they're less obvious, and secondly, a lot of these patients simply don't present acute problems. And so we often become nihilistic, as Peter mentioned, and particularly in the absence of viable treatment options for negative symptoms, they often don't get the attention they deserve despite their correlation with outcomes.
Yeah, Peter? I agree. Jonathan, you're really on target. I would add one thing, that what you do clinically will often depend on where the patient is at. So yes, if the person is relapsing or having acute positive symptoms, that is the focus, that is the priority. That's hierarchical. You do that first. Once you take care of that, which you can in most patients, then the other symptom domains become more important, relatively speaking. I think that's where we often drop the ball, and it's less of a crisis. It takes sort of more of a slow grinding approach, but shifting where are we in this patient, what are the priorities, positive symptoms, we're not losing sight of that, but often you can focus more on cognitive negative symptoms. And I think we sometimes don't even think of that.